In this morning's Health Watch, ask it early.
Yes.
Come on, ask it, JG.
I'm asking right now. You've sent us questions about everything from hydration to hot flashes.
That one came from Jeff, hot flashes.
Yep, lots of questions about hot flashes for me this morning. And medical correspondent Dr. Jennifer Ashton is here with all the answers. Doctor, good morning.
Good morning, you guys.
We're going to start with a question about the heat this morning. So here's what Charles is wondering.
What precautions do I need to take to avoid catching an asthma attack in this very hot weather?
This is so important because, a lot of people only think of asthma when they think of cold weather. And of course, any change or any extreme in temperature can trigger asthma exacerbations for people who suffer with asthma. The heat and the summer can be just as dangerous. We oftentimes hear there's an ozone alert or respiratory precautions for anyone with breathing difficulties. So you do want to take it seriously. There are a couple of tips that people with asthma or any kind of pulmonary condition should follow in a heat wave. Number one, of course, try to stay indoors as much as possible in cooler temperatures. If that is available to you, that's obviously a good idea. Stay well hydrated. That goes for everyone in this kind of heat and heat wave. Also, you want to have an asthma action plan and really follow it. You want to know what you're going to do if you get an asthma attack, when, and how you're going to take those medications before you get into trouble. And lastly, keep your medications current, make sure they're not expired, and keep them on hand and accessible. It's very, very important.
This is actually a little bit related because some people could worry about that asthma attack coming if they've been working out as well,
Correct.
Not just in the heat. This comes to us via Twitter from Toph, who says, what are the best foods to eat after a workout?
So important.
Good
Most
question.
people, when they're exercising, they think when I'm finished, I'm going to not eat for as long as possible and really keep that caloric burn going. That's actually the opposite of what you want to do. Also, people oftentimes think of electrolytes as what they need after exercising: potassium, sodium, glucose. Actually, what we know now, there's been extensive research in exercise physiology that shows that really you need to replace your carbohydrates and protein. I actually learned a lot about this when we spoke to Dara Torres, the famous Olympian swimmer.
Oh, there you go.
She has really taken this to heart, and this is the trend now amongst all athletes, not just your weekend warrior, but the elite athletes as well. What you want to do within 30 minutes of finishing a workout is replace those carbohydrates and protein. Best drink, not a sports beverage, it's actually chocolate milk. There was a study done at the University of Connecticut. They took elite runners, actually gave half of them a sports drink, sugary sports drink, half of them chocolate milk after they finished a run, did a muscle biopsy, and found that those runners who were drinking chocolate milk had a much greater stimulation of muscle fibers. So you're building
protein
more
in there is
muscle.
helping.
Correct, but you need to replace the carbohydrates. Otherwise, you will break down muscle after you finish working out.
Chocolate milk, how about that? Our next question comes from Olivia, who is wondering about sun safety.
Do people of darker complexion have a reduced likelihood of getting skin cancer?
Absolutely, they do. So African Americans, Latinos, Asian people can get skin cancer, just like people with lighter skin tones. Their skin cancer can be more fatal. You want to get a skin check every year. Watch out for the ABCDEs, asymmetry, border, color, diameter, and look for those skin changes.
And pile on the sunscreen no matter what. Jen, thanks as always.